Hi, my name is Lindsay Price and I am a community nursery nurse with Powys Health Visiting Service. I'm making a short video just to give you some information about our role as nursery nurses within Powys and perinatal mental health. So I sit on the steering group committee in Powys for perinatal mental health, and this involves service users, third sector, maternity and women and children services alongside primary and secondary mental health teams. So our role as nursery nurses within the health visiting team is to support the health visitor to deliver the Healthy Child Wells programme and support to the families from the day 10 of birth, around day 10 up until they go to school. But part of our role is to deliver support to women that have been identified either by a midwife or a health visitor to have mild to moderate mental health needs. So initially we would get a delegation from either of those professionals, and that in itself is nice that we can work across the whole sphere. So if we've been introduced to a woman in the antenatal stage, it gives nice continuity while she then transitions from the maternity team into the health visiting team. So that's a real nice benefit for us to be able to work both antenatally and postnatally. So some of the support that we might offer to women will be around early care of their baby, getting to know their baby, so just encouraging that recognition of cues that babies showing. Infant feeding support we can help with, gaining support from other people, so family and friends around them, just identifying those that are there for them, connecting them with other people, so reducing isolation, normalising some of those feelings that women have when they've had a baby, and just saying, okay, that's okay to feel like that, and it's quite normal. So you know, that's part of what we would do with reducing those thoughts as well. Supporting with other children maybe, so if they've got older children they might be struggling with parenting there, so we can support with that as well to again enable the woman to then support her baby and her children. And just nurturing that growing relationship between parent and infant. So some of the tools and approaches that we might have, so we use the Sully Hall approach, so thinking about that reciprocity and encouraging that between the parent and their infant. Containment, so helping to support that woman so that she can then contain her baby. And just behaviour management, so thinking about managing crying and all of those other things that might be useful. 5 ways to well-being, so just encouraging that nurturing of self, really making sure they're connecting with somebody, keeping learning, taking notice of things, being active. The Elkland Let's Talk with Your Baby programme, we may use that approach and that model to think about communicating and encouraging those communication skills with baby as they grow, and that social interaction that they will be having. And it also gives a nice set of really nice activities that you can do with your baby, and know that you're benefiting their growth and their health and their well-being. As nursery nurses, we often deliver community groups. So this fits in really nicely with the perinatal mental health, because if we're working with women on a one-to-one level, we can then bring them nicely into the groups that we're offering in the community to help reduce that isolation and facilitate that connecting with peers. So many groups run through Powys from the nursery nurses and other professionals as well. So they'll be walking groups. So that's locally getting people together so that they can have a chat as they walk with their buggies. That's a really nice way of connecting. And group infant massage we often do. So although we can deliver one-to-one massage, it's really nice, and it gives a different support mechanism really for women if they come to a group and have that. And in that sort of environment, when you're massaging your baby alongside, you really connect with the person next to you and those in the group, and you do share those experiences and become quite open when you're talking in an environment like that. So that's really beneficial. We work with our colleagues in public health and with the leisure centre facilities to deliver groups called Splash a Spree. These are a really nice introduction for baby into water, so it's for parents to attend. It's open for everybody, as along with all the other groups that we deliver. They can come along, meet other parents, do a bit of singing and introducing their baby to little water skills, which is a really nice activity to do. And when we're delivering them weekly, obviously that gives a really good focus for people to come out of the house at least once a week then to come and meet other people. So that's just given you an overview of our role within perinatal mental health in Powys, and I hope that's been useful. Thank you very much for listening.